Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthier Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Mountain Moving Faith. This is my latest book. And if you want to learn how you can move mountains, life has many mountains. While this journey, you will encounter mountains and you wonder, how can I move mountains? This is a book to read. And it took me time to research, to pray, and to wait on God and look at the scriptures and what Jesus talked about moving mountains. And this book is quite a story, it's quite an inspiration. It is quite something that will change your life. So order your copy today. We can send it to you wherever you are in this country. We will be able to send this book to you on Mountain Moving Faith. Call that number or send a message and our team will be able to ship it to you wherever you are. There's a book to read. You can also buy for your friend, for a family as a gift. And I have no doubt they will thank you and they will be always thankful for what you have done for them. So God bless you as you read this book, Mountain Moving Faith.
Did you know that your favorite fatty meal could be the reason behind that sharp abdominal pain? Now, how do you deal with that from a medical perspective? Welcome to the Healthy You. This is your favorite health program on Faith Today television. My name is Enock Kitondekijja. I'm a medical clinician and your host. Tune in as we decode the hidden impact of the diets that we do indulge ourselves in. Allow me start by doing this very important thing, reminding you that this program is sponsored by JCK Hospital. You can find them in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. They are also in Juja Farm and Maria Ini. Are you around those areas? These people are right there at your service. Needless to say, the game is getting even bigger and better. Are you a student or a healthcare provider? And you're ready to take the next step towards a rewarding health career? The good news is JCK Hospital College of Health Sciences is now open for admissions. Start applying, use that number on your screen and secure your slot. 2025 should not be a normal year. Take this to the next level. They are accredited by TVET and NITA. So for you to know. So students, make sure you utilize this time right now. Now the topic of our discussion today is about the fatty foods we eat and how are they related to the abdominal pain. We had that argument the other time. People are wondering, whenever I eat fatty foods, I get this pain. What does that mean? What do the medics have to do? What do you need to do at this time? Now, to take us to that level, to help us unpack everything that you need to know about this, is a general surgeon. This is a gentleman who is coming back because of the demand. Those of you who followed our previous session, you know he gave us so much info regarding heartburns and acidity. He will give us a recap in a short while. But before I invite him to take us to the next level, I'm aware we have those of you who are following us on social media. Let me tell you, we celebrate you and we recognize you. Remember to subscribe, like, share this. You don't know how far it will go to impact a life. Thank you so much. Back to my guest, Dr. George. Welcome once again to Faith Today Television.
Thank you very much.
Could you please reintroduce yourself to our viewers for the sake of those who missed you last time? Yes.
My name is Dr. Njihia George. I'm a general surgeon. I have my clinic at Hamat Healthcare that is located in Membley. We also partner with different health facilities, including JCK Hospital. So today's topic is quite interesting because it is borrowed from what we had last time. So due to the fact that today's topic is highly related with what we did last time,
yes,
I think it will be wise to start off by recapping what we had last time and then marrying it together with what we are going to discuss today. We know it's Christmas season, festivities are here. Many people are biting on fatty foods, and as they bite on that, they experience abdominal pains. So we shall see the link between what you eat and how it affects your body and how we can handle that and help you enjoy your Christmas.
Thank you so much. That is Dr. George. Like he has said, you don't want to change your focus, you don't want to change your dial. This is Faith Today Television, once again, giving you quality information regarding your health. Now, we are going to kick this off by giving a recap. I know most of you that were with us last time, you had a number of questions, but Doctor here has a bit compressed everything, summarized it in this recap. So pay attention. Now, if you have any question, please remember to use the number on your screen. Do not miss this time. Doc, kindly do the recap for us before we hit the main agenda of the day.
Okay, last time
yes,
we had a discussion on acidity. You'll allow us to focus on what we did last time.
Yeah.
Acidity, as we defined it last time, is that very uncomfortable sensation that one experiences in the upper abdomen, yeah, all the way, and then you experience a reflux that goes all the way to the normal swallowing, able to swallow food from the food pipe all the way to the stomach, to the first part of the duodenum. Now, in relation to today's topic, we shall be focusing on this small organ on the right side of the abdomen, right upper part of the abdomen, known as the gallbladder, because that's what really causes your pain once where you eat a fatty meal. So this is just a diagram just showing how we normally swallow. Of importance in this diagram is this junction, the junction between your esophagus and the stomach. The esophagus is a food pipe. There is a valve there known as the lower esophageal sphincter that ensures the acidic contents stay within the stomach cavity and do not reflux upwards. So what happens when you get acid reflux? That uncomfortable feeling that you experience in the upper part of your abdomen, going all the way to your chest, that also goes all the way to your throat, and also to your mouth, is because the lower esophageal sphincter, as demonstrated at this junction here, the lower esophageal sphincter is loose or weak, either by intrinsic factors, that is factors within the stomach and the food pipe itself, or extrinsic, that means there's a problem that is pushing or affecting your lower esophageal sphincter, allowing the acid to go up, hence giving you that acidity. So the major issue that came in was diet and lifestyle causes of acidity or heartburn. Number one was overeating or binge feeding. Right now I know it's festivities. Someone normally takes one plate of food, but for a reason or another you find yourself taking 2 or 3. So when you find yourself binge feeding, that is a cause of acidity. When being obese or overweight, lying down immediately after having your meals, when you have reduced water intake, excess intake of caffeine and carbonated drinks, excess alcohol intake, smoking, certain medications, especially the painkillers that we commonly use, irregular eating habit or skipping meals, low fiber diet, excess salt intake. Remember, most of our foods that we are currently using are usually preserved with salt. You'll find when you buy your packet of crisps, it has a bit of salt. Any food that you buy that has been preserved in one way or another, your sausages or anything like that, has quite a bit of salt in them. When you have chronic stress, as we described last time, chronic stress works the same, has a similar approach, just like medication. Because when you're stressed, you release cortisol in your body. And when you release the cortisol, it affects the inner lining of your stomach. And once the inner lining of the stomach is affected, leads to ulcers developing. Not having enough sleep, living a sedentary lifestyle, and lack of sufficient exercise and or other physical activity. So those are the common causes of lifestyle changes. Yeah. So how GERD affects your body, that is how reflux basically affects your body. Patients get sore throat. As I say, the acid goes all the way to your throat, so you get sore throat. And if this sore throat is not treated in good time, it usually leads to tumors developing around there. Some people even get a hoarse voice. People aren't able to speak for long, consistently. This is a common cause of bad breath. Remember, this is acid that is corroding your mucus lining of the stomach. It also leads to something known as tonsillar stones. Those tonsillar stones also cause bad breath. So it's important when you have bad breath, persistent bad breath, on top of just having been checked out by your dentist or your ENT specialist, it's also important to rule out if you have a history of reflux. So bad breath is dealt with from a multidisciplinary kind of an approach. People usually experience difficulty in swallowing, nausea, that is a feeling of continuous, nausea, that is a feeling of having like you want to vomit, chest pain, and heartburn. So this chest pain, we said it can mimic even that of heart origin. It's not once or twice we've had patients who come in thinking that they have a heart condition, and yet the problem is actually chest pain. And then people come in with respiratory issues that mimics asthma, regurgitation, vomiting, and a lump in the throat, and finally tooth damage. So this tooth damage is more common among pregnant women. So lifestyle changes, number one is, of course, you stop smoking, you manage your weight, enjoy smaller and more frequent meals, wear loose clothing, and avoid food, and avoid foods and drinks that trigger, and sleeping with the head propped up. So I think that is what we can do for today in terms of a recap, then as we progress.
Wow, wow. Thank you so much. Thank you so much. And for those of you who are just joining us, this is Dr. George here, the expert, taking us through the recap of what we really discussed last time. This is because of the demand. And those of you who missed the entire segment, please go back to YouTube and then go through everything. I'm sure your life will not remain the same. He has talked about lifestyle playing a very key role here in the acidity and then messing up with our digestion. So today we want to really narrow down to the fatty foods, the kinds of foods we eat, how they impact our health, how the abdominal pain comes in, and I believe this is the best time for you to now get details. So Doc, help us understand what exactly happens in our bodies when we eat fatty foods, and if you would give us an outline of these fatty foods, and then how do they even trigger the abdominal pain?
Now, as we shall be demonstrating, today we'll do a lot of demonstrations. I believe it will help our viewers to really understand. There is a way, once you have a fatty meal that goes into the stomach, it triggers cholecystokinin, which is a digestive hormone that is used to stimulate the gallbladder to produce bile acids that help with digesting the fat. So the problem is, the initial problem where you encounter abdominal pain is because you have that cholecystokinin that has stimulated the gallbladder to to contract. And once it contracts, it usually leads to abdominal pains. So I think the best way is to demonstrate that, how it is all related. There is something we like to show.
And as you demonstrate, what are some of those foods, the fatty foods that people
now,
need to know?
The typical fatty food is one, it boils down to how we prepare them.
Okay.
So you'll find when people are cooking, they add a bit of cooking oil. That cooking oil is sufficient to trigger an abdominal pain. There are people who generally eat foods that have basically been deep fried into fat. So things like chips, even your typical meat usually has a bit of fat.
Okay.
So fats are usually divided into two. So there are those that are known as saturated, and those are known as unsaturated. And fats can also be plant-based or animal-based. So it doesn't really matter whether you're using a plant-based or animal-based source of food. As long as source of fat, as long as there is fat within your food, it is sufficient to trigger the cholecystokinin hormone once it reaches your stomach and the duodenum. So that presence of mere fact that you have taken a fatty meal will trigger the cholecystokinin that eventually leads to the contraction of the gallbladder. Now that contractive ability of the gallbladder is what really triggers the pain.
But I mean, do we have to experience pain every time we eat
a
fatty meal?
Ideally, when you eat your meal, it should be pain-free. Nobody should take a meal and then you feel pain. That is wrong.
And that is very important. As you go to illustrate, for our viewers, the doctor here is helping us understand whatever kind of fat you are eating, be it plant-based or animal-based, as long as it is fat, the body will identify it, and then whatever is going to show us will be happening. So go ahead and illustrate.
Yes. So as I say, today we are having quite extensive discussions. So I'm not a good artist because I never did art when I did med school, but I believe we'll be able to appreciate what we are dealing with. So this is the liver. So the liver usually has two sides. There is a right side and a left side. Okay. So the liver is the source of bile in the body. So, and then the bile comes in and stored in this small organ here, known as the gallbladder. I'll abbreviate it as GB. So the gallbladder is what produces the bile. So so this is the liver, this is the gallbladder, this is your the other digestive system comes in place here. There's a stomach, okay. Sorry.
I think it is very important to go to an art school. I've realized I did wrong to miss that class. And I think we missed together. As you illustrate, let me also look out for something more vivid that we can probably relate with as you illustrate.
So, this is the liver, this is the stomach here. Are we together? This is the duodenum. The duodenum is the first part of the small intestines, and then this is how your bile flows into the duodenum at this point. Okay? So the minute you have your fat lands in here, whether it is plant-based, whether it is animal-based, it doesn't really matter. As long as you have as long as you have your fatty meal and the food lands in the stomach, it triggers cholecystokinin. The pain that we experience is usually arising from the gallbladder. Typically, pain in the gallbladder, patients will come with pain on this region, that is the right upper quadrant of the abdomen. That pain radiates to the shoulder, and patients usually come in when they are stooped forward and leaning a bit to the side. Are you together? So you'll find patients walking in a position similar to this, because of the pain around that region. And then it usually comes in with similar symptoms to that of acidity.
Yeah.
So you'll find patients are complaining with pain around here, around the upper part of the abdomen,
Yeah.
concentrated more towards the right, and they also have a bit of reflux symptoms. So initially someone may come thinking that they have acidity, and yet their problem is triggered by this. So how we identify is that the patient usually takes in not all meals. So let's say you'll find patients have already discovered that they don't have to eat boiled food. I mean, they don't have to eat fatty foods. So you find they prefer doing boiled meals. They avoid putting fat in their diet because they've noticed once they take anything that has fat in it, it triggers a pain. So normally the pain comes after feeding, around 30 minutes after feeding, and can go as long as 8 hours after feeding. So the pain is usually located in this thing known as the gallbladder. Okay. So pain within the gallbladder is because of that cholecystokinin hormone that is produced once you eat that stimulates the gallbladder to contract. Remember, your gallbladder stores bile.
Yeah.
So once it stores bile, the bile comes down and then goes into the first part of the duodenum, the first part of the small intestine that's in the duodenum, to help digest the fat particles there as it is moving down towards the other parts of the small intestines. So that is how it is all related. Okay. So initially someone might think because I'm eating a meal that is fatty and I get abdominal pains, that is ulcers.
Yeah.
Remember last time we discussed about ulcers? So the ulcers which come in after, which usually are triggered after a meal. But for this one, it's usually specifically related to fatty meals.
Fatty meals. And that's very important. Those of you who are just joining us, Doctor here has given us an illustration of the entire process, how food gets into your system, and then how the system triggers, communicates with the gallbladder to release, you know, these enzymes that break it down so that you can have value from the food you're eating. And then this takes us to the next question. Why the pain? I mean, what is wrong with the gallbladder? How do we deal with the pain?
So I think I'll wrap this as we go to the next part. So we'll come to the gallbladder. We are narrowing more and more towards the gallbladder.
I think that's very important because when people can tell now if it is coming from fatty food.
Yes, it is related to what we discussed last time. It's a completely different entity. So the gallbladder, so this is from the liver, the right side of the liver, from the left side of the liver.
Yeah.
Okay, they come and join together. Then it is joined here now by the gallbladder. I'll give it that. I'll abbreviate it as GB. And then we shall demonstrate, then this is how it flows. Okay? So, normally, if there is a stone, as I said, stones are the most common things that usually cause this. So stones themselves are usually caused by cholesterol. So it's very common to find in these, especially the plant-based oils that are in most supermarkets, talking that it is cholesterol-free. They're very big on saying it's cholesterol-free. Truth is that all these fat-based things, all these, whether it's animal or plant-based, they all have some cholesterol in them. Some have more, some have less, but they all have cholesterol in them. So these stones are usually cholesterol-based. Okay, so the minute you have that stone, and then you take your fatty meal, cholecystokinin stimulates the gallbladder to contract. That contractive pain is what causes the abdominal pain. So you'll find the pain is usually here, usually have biliary colic pain. That is pain that holds you, grabs you nicely. You feel like something wants to pop out, and then sometime it releases. Before you take in a breath, another one comes in, holds in, and then releases. The same thing that happens with when women are having like their menstrual periods. They usually have that crampy pain. So it's a similar thing, a lot of crampy pain that is holding you and releasing, holding and releasing. In the mix of that pain, it triggers a nervous reaction within your body that now leads to things like increased acidity within the stomach, increased reflux, and some even end up with vomiting. Now, how we deal with this is, number one, address your cholesterol, how you are taking in your cholesterol. Remember, nowadays, we are cooking everything with fat. When you're having your vegetables, you put in a fat. When you're having some even in ugali, nowadays they're adding some margarine into it, which is basically still a form of fat. Okay? When you're having your bread in the morning, it has fat. When you're having your cakes, it has fat. When you're eating your mandazi, your chapati, it has fat. When you're eating, actually, almost everything we are eating.
But Doc, before you go any further, I'm enjoying this discussion. You are really condemning fat a lot. But my viewer is wondering, because they are also, you know, we also know that fat is good. It's not entirely bad.
Yes, true.
Because, you know, fat helps make the hormones, it's a great composition of the brain. You know, now, really, why are you condemning the fat?
Because our fats are processed. They are not natural fats. The fats we are using are processed. Anything that is processed is not natural. So you'll find the natural fats that we find, like things like in avocado, that is a good source of natural fat. The natural fats we find in things like coconut, that's a natural source of fat. The natural fat we found even with our own animal proteins, that is also a natural source of fat.
So in other words, you advocate for natural fats?
Yes.
Okay.
And like using processed. Unfortunately, processed is what is available and has seriously been commercialized.
Okay.
Yes.
That's good.
So when it comes to what we do about this is, number one, we need to identify who is at risk.
Yeah.
Okay. So risk factors are usually a hot potato. So who is at risk?
Yeah.
Okay. We usually have the 5 Fs, females.
Yeah.
These females tend to be fertile. So that means it is common among women who are in their fertility years.
Yeah.
So people who are currently experiencing their menstrual cycle.
Yeah.
Then they usually tend to be in their 40s.
40s.
So you are mostly in 40-something year old. Okay, so you're female, you're fertile, and you're 40s. Now, the other thing, majority tend to be fat.
Fat.
Yes. So
we call them healthy.
Now, fat is not a very good English in terms of sounding politically correct.
We normally call them healthy.
Yeah.
But it's not healthy, right?
It's not healthy.
Okay.
But at the end of the day, usually it affects people who have a bit of weight, people who are obese. And finally, they usually tend to be fair looking.
Okay. So it's really
this is not a disease of ugly girls.
Really? Fair looking women.
Fair looking women.
Is that proven, really?
Yeah, this is majority. Because
most of my family members are fair looking.
Now you have a problem.
Really?
You need to check them for gallbladder issues, especially if they happen to be in their 40s.
And now, speaking of fair looking, for our viewers, we are going to take a short break. This is getting very, very exciting. Are you a female? Are you fertile? Are you in your 40s? Are you fat? The other day we were doing BMI, Doc. We invited people in the conference. JCK Hospital was giving services. They were calling people, come, let's take your weight. Let's help you know how much you weigh and how it's affecting your health. But now this discussion is making sense. So if you are not sure about your weight, this is a very interesting discussion. You know someone who you normally call heavy, fat, or whatever you call them, forward to them this link, because this is a very interesting conversation. I know the questions are coming in. We are going to answer them in the second part of our discussion. I know Doctor is coming back to also help us understand. There are people who be like, you know, if this thing is causing me pain, can't you take it away? I mean, we want to understand what are the risks, what happens when you don't have that pain that you want to get rid of, or the gallbladder, like very many. It's a very interesting discussion that you do not want to miss. This is Faith Today Television, and this is the Healthy You program. Do not change the dial. Do not go anywhere. We are coming back.
Okay, asante. Nilikisajili kitabu ambacho kinaitwa 7 Keys to Success, ama kuna kanuni funguo 7 if you like it, ambazo zitakuletea ushindi na kufaulu maishani. Wote, wewe na mimi, tunataka kufaulu, lakini pia kuna njia ya kufaulu. Ukisoma hiki kitabu ambacho nilikiandika kwa kufanya utafiti, kwa maombi mengi, kuangalia neno la Mungu, I have no doubt ya kwamba hiki kitabu kitabadilisha maisha yako. Nilikuwa naongea na mchungaji rafiki yangu akaniambia, nilisoma hicho kitabu, sasa ninafundisha watu wangu kupitia ujuzi maarifa, hekima ambayo nilipata kwa hiki kitabu. Kwa hivyo unaweza pia nunulia watu wengine, na akaniambia alinunulia hata viongozi wake, na wamekuwa wakisoma, wakaweka kwa library yao wanasoma. Hiki kitabu sina mashaka, nina uhakika itabadilisha maisha yako na utabarikiwa. Tuma message ama upige simu kwa hiyo namba, na naweza kuwasiliana na wewe, na utapata hiki kitabu, utatumiwa, usome na ubariki pia watu wengine. Asante. Mungu akubariki unaposoma 7 Keys to Success, and you will succeed. Thank you.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV. Alright, welcome back once again to the Healthy You program on Faith Today Television. As we left it at a point where it was getting even more interesting. A doctor here talked about the risk factors that could predispose you to having this abdominal pain, and then that could be linked with the fatty foods that we are eating and things like that. So he talked about something very key. He talked about fat. If you are indulging in so much of the unnatural, artificial fat, you are at risk of developing this pain. He talked about you being a woman, a female. That means if you are a brother who is watching this, this is a good time for you to forward the link. And then she talked about fertility. I have issues with that myself, because when you talk about fertility, I'm wondering, even Sarah in the Bible talks about she was fairly looking. In fact, doctor has to start with explaining to us what does it mean by fairly looking, because in church we have very many fair looking people, and so we really want to break that down. We want to understand so we cannot, you know, be compromised by these health issues. So Doc, we left it at fertile, fair looking, and in their 40s. What do you mean by fair looking?
Now, fair looking, one, they actually tend to be very beautiful ladies. And majority are usually brown skin, rangi ya thao, light skinned people. Those are the ones who are majority at risk. Okay. And then being fertile does not mean having children. That's a whole topic on its own. My colleagues from the gynecology department will handle that. Yeah. But for us, we define as fertile as surgeons. There's a way same condition is looked at differently by the different specialties. Yeah. So for us, fertile is usually somebody who is still experiencing their menstrual period. Okay. As long as your hormones are active enough to help you produce your menstrual period, then you are considered fertile. The fertility topic is a different story that our colleagues in the gynecology area will help define. Then fat, let me just go a bit deeper. Now fat, weight to weight between a man and a woman, the man's, assuming they're all 70 kgs, but men tend to have more muscle bulk and more bone bulk compared to our female colleagues. So fat usually tends, even if they are both of them at the same weight to weight, women have a higher fat concentration in their bodies compared to men, even if they're in the same weight bracket. Female, that is direct, straightforward. And then 40s, these are people in their from 40 years all the way to around 50. But because of our lifestyle, we indulge more and more in these processed foods and all that. So it's common to find even people in their teenage years and even in their early 20s having a similar condition, mostly because of our diet. So if you're looking, at least that one we've been able to discuss. Yes. So those are the risk factors, and we've discussed about the pain, how people usually present, and how it starts off.
Okay,
Yes.
and that is very interesting. And those of you who are tuning in, this is typically Faith Today Television giving you the Healthy You Talk classics from our doctor here. So speaking of the risks, Doc, we want now to understand, how do you deal with this pain? How do you really deal with this pain? Because people don't have to be in pain.
So
Yes.
number one, as we discussed even in the previous topics, you don't have to eat to have pain. Remember, this is festive seasons. You're supposed to enjoy your meals normally. Whatever other people are eating, you're supposed to enjoy it. I don't believe in you've gone for a wedding, or you've gone for some, or even yourself cooking food in the house. There's a special meal for you, and there's what other people in the family are taking. You're supposed to enjoy meals comfortably throughout. Okay, so now what we do, that is now in terms of investigations, they usually classified into A, there is blood works, blood labs, and then there is imaging. Okay, and then finally there is diagnostics. So all these are important in helping you define what kind of a problem you have. Now, I'll refer strongly to this image, because depending on where your stones are, it presents differently.
Yeah.
Now, if the stones are purely within the gallbladder region, that is very easy, because we just need to address the gallbladder itself. However, if the stones are outside the gallbladder, depending on where they are, we shall be able to discuss further. So the blood works that we usually do, the one that usually gives us a leeway, is what to do. I'm aware which step we are in is blood tests. Number one, remember, these patients usually come in pain. So when they come in, the first thing we do is to knock out the pain. So we give them painkillers so that we're able to investigate them when they are pain-free. Some of the procedures that we are doing on them involve a bit touching around that region. So the blood works we do primarily is a liver function test. So the liver function test has, I know this is not a medical class, has a way it can classify the condition, telling you, is the problem arising from within the biliary system, what are basically drawn is the biliary system, or is the problem arising within the liver itself. Remember, this is part of the liver.
Yeah.
Okay, so that is part of the liver. So whatever drawn in blue, and whatever is in black is the biliary system. So if the problem is within the liver, the approach is very different. Okay, so some of the things that can be within the liver is usually mostly tumors or cirrhosis, especially our colleagues who indulge in a bit of alcohol. You can find yourself having a damaged liver. Then, if the problem is within the biliary system, depending on where the stones are located, we shall manage them differently. If the issue is within the gallbladder alone, so the blood works will be able to guide us.
Yeah.
Remember, as part of your blood works, we usually do blood tests that usually test for cancers. And the reason is it's not once or twice. We've had a procedure of removing the gallbladder. Then when you submit it for histology, it comes in telling that the patient had a tumor within this system. So their blood...
Speaking of removing the gallbladder, can I function normally if I
Yes.
don't have the gallbladder?
The gallbladder is similar to the appendix. Most people are used to having appendix surgeries, and we know we can survive without the appendix. It's the same thing, we can survive without the gallbladder. And I'll come to a discussion on that once I finish the imaging part.
Yeah.
So the blood works include the liver function test and also the tumor markers. The reason we do tumor markers, I've explained, is because of that risk of having a tumor.
Yeah.
The other thing is imaging. The most easily and accessible imaging modality we have is an ultrasound. So most of the time when you come in with right upper quadrant pain, that is pain around this region, the ultrasound is easily available. It tends not to be very expensive, and most people have access to it. Yeah. So when you do the ultrasound, it can give us a guideline on where the problem is. Above the imaging on the ultrasound, we usually go into having an MRI. An MRI of this region can further define this system better than an ultrasound. Then eventually we have the diagnostics. Sometimes we do the OGD. OGD, we discussed the endoscopy last time. The endoscopy, we usually have a special endoscopy that goes beyond just studying the food pipe, the stomach, and the duodenum. It also is able to enter this channel through the pancreas, studying all the way to the liver up there, and all the way to the gallbladder up here. Okay, yeah. So the advantage of the diagnostic, that is now the ERCP, is basically a form of endoscopy. It also gives you a chance to remove whatever stones are within this system. Yeah. And also if there are any tumors, we also collect biopsies. And if this system is blocked, we are also able to put in stents and dilate the system so that the bile is able to flow. You asked a good question before we go on, if you can survive without the gallbladder. So assuming this is the system, this is the right side of the liver, this is the left side of the liver, bile is produced in the liver. So when we remove the gallbladder at this level, at that level, you can clearly see that bile will still be able to flow from the liver downwards, from this side downwards, all the way to the duodenum. So the duodenum is at this level. Let me just add it there. Okay, so the duodenum is at that level. So bile is still able to flow. So it doesn't mean because the gallbladder has been removed, you are not able to function. Actually, you're able to function because bile is produced in the liver and you haven't blocked how the system of bile flows. Okay,
but now, I mean, what if I want my gallbladder to stay and I still have the pain? How do you deal with
now,
that?
There are medications that usually help dissolve these stones, but the failure rate of those medications is still fairly high and it's still fairly experimental. So we usually say we cannot force you into doing having a surgical procedure. So we'll give you, number one, you usually have to be on lifestyle changes, including the diet that you're talking about. Yeah. Number two, we usually encourage that you're almost always on painkillers, and taking painkillers on a daily basis is not a cup of tea. And then we give you those drugs, the likes of UD-HEP and the likes, that usually help dissolve. But if the stones are very big, it may not work.
Now, another question comes in, because I know our viewers are really, let me see if a viewer asked it, because probably we want to also hear what they have to say. And for those of you who are just joining us, we have the entire overview of where this entire pain comes in and how it's connected to the gallbladder, the foods we eat, how they get to investigate and then come to narrow down to the real cause of your pain. I have Jocelyn right here from Comoros. She's saying, wow, this is an interesting discussion. Someone was telling me that cooking methods like frying or baking affect how fatty foods affect you. Is it true?
The principle is, as long as that food of yours has fat, it will trigger your cholecystokinin in the stomach that by reflex triggers the contraction of the gallbladder. And once, if your gallbladder has a problem, that contractive force of the gallbladder will give you the abdominal pains. So it doesn't really matter whether it is baked, whether it is whichever formula you use, as long as the fat is there, it will trigger that mechanism. Good. The other thing I need to emphasize on this, fats are also very important. We don't want to say that we get rid of fats. That's one thing. Because there are some vitamins which are only absorbed into the body in the presence of fat. They're usually known as the ADEC. Vitamin A, vitamin D, vitamin E, and vitamin K. So vitamin A is good for your eyes. So if you don't have vitamin A, you will end up with night blindness. Vitamin D is good for your bones. If you don't have vitamin D, you get rickets. Vitamin E is good for your immune system. So if you have a problem with your immune system and also how the cell membranes are, is usually triggered by vitamin E. And vitamin K is important for blood clotting.
For blood clotting. Speaking of blood, Doc, because we have too many questions today.
Yes,
I don't know how you'll handle them.
No, I'll try to be as fast as possible.
Good. This is Joanne from Roysambu. She says, I think my son is intolerant to meat. Are there signs that one can observe to be aware of?
Intolerance to meat mostly comes with reactions. You usually get presence of boils, rashes over the body, itchiness once they consume it. So we usually advise such patients to see a nutritionist to go for alternative source of protein.
Alternative source of protein from a nutritionist.
Yes.
Good. Then we have another one coming in from, okay, she says, Rehema in Thika. Welcome back, my favorite show. I think she missed it. Rehema, thank you so much. And then she says, please help us learn How is saturated fats processed compared to unsaturated fats in relation to abdominal discomfort?
Number one, there's no difference. How the body reacts to fat is the same. Okay? As long as, in the topic of abdominal pains, I'm not talking in the topic of cardiovascular disease, that's a whole different element altogether. Because there's a difference in the way they affect your hypertension, your heart disease, your diabetes. So I'm just talking this in the relation to abdominal pains.
Yeah.
As long as fat hits the stomach, there's cholecystokinin that is produced. And once it's produced, it triggers biliary colic. That is now pain within the gallbladder.
Wow. Rehema, you have your answer there. But in case you are not comfortable, please make the question. Let it come. The doctor is here to help us today. Well, there are many questions today.
Yes, yes.
I hope we'll do justice to all our viewers. And we really appreciate those of you who follow us ardently. This is really making sense now. Ken says, I'm here enjoying the show. I normally have pain after taking my meals, especially at night. Are there any dietary changes that can help me?
Now, pain that comes with after taking meals needs to be defined further. Because there is pain that comes specifically, this one is more of if you take your fatty meal, which is today's topic. But at the same time, maybe the patient has ulcers. Because as we discussed in the last view, maybe you can have a recap in the last video that we did, for the last show that we did. It shows that if you have duodenal ulcers, that is ulcers within the duodenum or the lower part of the stomach, once you have a meal, that's the time you trigger pain. Or at the same time, the patient could be having other issues within the abdomen. So I think we need to really examine that more.
Oh, is it a point where you invite him to the
Yes,
hospital?
yes, they come to the hospital for further evaluation.
For
Yes.
further evaluation. I think that is very important because even this show, we do not really give diagnosis. We do not really recommend anything. We just have to guide you to make the right decisions after having an interaction with the doctors. It's very, very important. It's just to open your eyes. And I have, okay, this one didn't specify the name. She says, morning faith today. Can fatty foods trigger conditions like IBS or GAD?
Now, yes, both. Because IBS is known as irritable bowel syndrome. So with irritable bowel syndrome, just as an overview, is that your bowels, your small intestines, your large intestines are irritated. And as you said last time, once your bowel is irritated, it responds by either having a diarrhea or a vomiting episode. So you find there are people who once they have that meal, they have a huge purge of diarrhea. Or at the same time, their patients usually get, when you combine a lot of fatty plus together with salt intake, you get that reflux. So it may be a myriad of things. The best way is to come for a consult.
Then GAD?
Yeah, that's the same thing. That's what I was saying. The GAD is reflux. Yes. So reflux, especially in the combination of fat with a lot of salt, usually leads to GAD. Fat with a lot of salt leads to fat. I mean, it leads to GAD.
To GAD. This is very interesting, Doc. You're really sharing valuable information. And then we have another one asking, Daktari, is it possible that fatty foods can affect my menstrual cycle or ovulation? This is Faith from Limuru.
No. That is a fertility issue. That's usually more of a gynecological. So I will not go into discussing that. But there's no relationship between your fat intake against how your menstrual cycle is. There's a relationship between stress and how your menstrual cycle is. There's a relationship between your nutritional status and how your menstrual cycle behaves. There's a relationship between physical activity and how your menstruation goes. But there's no relationship between your fat intake against how your menstruation goes.
Okay.
Yes.
I think that's very interesting. This brings me to the question. You guys are handling a lot of these cases, and I see it is a multidisciplinary approach. Are there challenges that you face while diagnosing this condition relating to dieting?
Yeah, there are actually a myriad of things. Number one, there are cultural beliefs that sometimes when you tell somebody to avoid these highly fat meals, they wonder how they can survive because that's what they have known most of their life. Then the other thing is usually a cost impediment. Sometimes when you're asking someone to do the blood test together with imaging and possibly a diagnostic, the bill for the patient goes a bit high. Another thing is when you mention the word tumor markers, everyone thinks they have cancer. So it's usually a routine that if you have a gallbladder problem, we also have to screen out for cancers in the mix. So usually do some blood tests that can tell us, give us a hint, will you be having a cancer or no cancer? So when you mention that, patients become very anxious, and they become, everyone wants to be told they have a cancer. So usually that is one of the biggest challenges that we usually encounter.
Okay.
Yes.
That's quite interesting. And then questions are really coming in handy. We have, this one did not specify. Kindly remember to let us know your first name and where you are watching from. It will help us really help you better. This one didn't specify. But she says, is there a recommended amount of fats that can support health without issues?
It's difficult to calculate, but the normal is 9 to 12 grams per day.
9 to 12
grams per day.
Yes.
Now, if you are to calculate this 9 to 12 grams per day, when you go to the kitchen and when you're cooking, the sufuria that you use to cook, when you just smear cooking oil at the base and then you tilt at the corner, whatever extra oil collects at the base there, that is extra. So that one you should put back to your container or somewhere else. Then you cook with whatever you just spread at the base. That is sufficient for you per day. But unfortunately, that rarely happens, because you'll find people when they are cooking, even the onions, they're basically deep frying them. So 9 to 10 grams per day are usually sufficient for an adult. Yes.
Okay. There are people who use virgin oil, I hear olive oil. Is it also a concern?
In relation to today's topic, there's no difference. In terms of abdominal pains, there's no difference.
I thought it.
But in terms of other nutritional benefits, like in terms of hypertension, in terms of lipid control, cholesterol control, in terms of diabetes relationships, in terms of blood vessel disease, in terms of people who have neuritis, that is problems with their eyes, the plant-based unsaturated fatty acids tend to be better than the saturated. So in relation to today's topic, I don't want to veer off. You'll realize I'm trying to stay on course.
Yes, yes.
Because I think the next discussion you should have is now about how the different fats are related to the different health conditions that you have.
Yeah,
so I'm trying to stay within the topic of the day.
Okay. You have a number of questions today. So
yes.
Do you mind sitting? Or
it's okay. It's okay.
Yeah, standing. And this is Dr. George here, and he's ready to help us and guide you. He's also a surgeon. You do how many conditions, by the way, do you work on? Because I called you in the evening last time. You were handling.
So general surgeons,
yes,
we mostly deal with thyroid conditions, breast, abdominal issues, and anorectal region. So a thyroid, at least it's very forward, it's the gland around here, the thyroid. Okay. Then the breast are also very clear. Okay. And then abdominal is the stomach, the food pipe, the intestines, the liver, the pancreas. Okay. And then we touch a bit on the urology, just a bit. Then in the anal region, you also have conditions that we deal with in the anal region. Yes. It
happens, it looks like you are doing a lot of things. Do you have an experience, a story of a client that you've really worked on, and then they were presenting with this? How did they respond? And how is their life expectancy after?
There are quite a number. This is one of those conditions we deal with almost day-to-day basis. Mostly they're usually women who've come in with acute severe abdominal pains.
Acute meaning? How long?
Acute means is short period.
Short period meaning days or weeks?
Within a day. Okay. Someone had gone somewhere, was eating at night, went to have a burger, chips, then they come in with severe abdominal pains. There's also a huge number who come in who know they have gallstones, but they opt not to have surgery. So they've been on chronic use of painkillers for a very long time. So you find someone has had them for like 3-4 years.
And you say that is not okay?
That is not okay. But you find, as I said, we cannot force you into surgery.
Yeah.
And this is one of those conditions which you say is about improving your quality of life.
Yeah. Speaking of improving quality of life, someone whom you've really detached the gallbladder, how is their life Like
normal.
Normal.
They eat normally. The previous symptoms they had, they go back to living stress-free,
Okay.
condition-free. Okay.
Yeah.
I think what we should discuss is what stands out for me is part of the complications.
Yeah.
The major complication that we encounter is the one that causes pancreatitis. So when the gallstones go lower into the system, then they go into the pancreas.
Someone has not dealt well
Yes.
with the stones in the gallbladder.
Now, those ones are the ones usually that stand out for me.
Before you talk about that, I know we can have a whole discussion about that. Someone may strangle me if you don't answer this one.
Yes.
This is called Karim. I'm asking for a friend. Is there a connection between frequent abdominal pain and hormonal imbalances in women?
Yes. And that is not a topic related to what we are dealing with today. So the hormonal imbalance that usually comes in is multifactorial. So you can have an hormonal imbalance of the thyroid gland, you can have an abdominal a hormonal imbalance of the adrenal gland, you can have an hormonal imbalance of your fertility hormones, the estrogen and the progesterone. And then most of the time, the abdominal pain comes in relation with fibroids. So that is now another topic outside what we are discussing
And
today.
I'm sure, Karim, we are going to accommodate you with time. We are going to be closing this, but before we do, I think this one is hot. She says, the show is top. Is it true that healthy fats can help with weight management?
Healthy fats can help with weight management.
Igi Mayai, she's even giving examples. Mayai.
Yes, yes.
Watching you from Jessica Roysambu. Hallelujah.
From inside the hospital.
High five for that one.
Yes, it does, and you have to balance the quantities.
Yes.
Remember, whatever you take in excess becomes poisonous eventually.
Okay.
So for your eggs, we usually recommend 2, at least, that is 2, twice a week. As twice a week has been the maximum of it.
Okay.
Yes.
I mean, we cannot really exhaust this because of time, Doc. Just give us your parting shots, more so for someone who is having abdominal pain that is tying into their diet, the food. What should they do? Looking that we are also going into the festive season, I believe someone can take something key from your parting shot.
Number 1, if you experience pain of any sort, or either vomiting or diarrhea or episode of constipation related to any food, that is wrong. We believe in encouraging people to have quality of life. Quality of life means you're able to enjoy life to the fullest, you're able to be productive with your family, with your workplace, with your social environment, and there's nothing as bad as you've been invited somewhere, but you already have rules on how they're supposed to cook for you or how they're supposed to prepare meals for you.
Special case.
Yeah, special case. When you're going to high school, you're on a special diet. It becomes very troublesome. So we'll encourage you to please get a diagnosis for your underlying condition. Once you have a diagnosis for your underlying condition, we treat it. And there are conditions which are treated permanently. Things like this, gallbladder is one of the conditions that can be treated once and for all. Things like hiatus hernia, we discussed that last time, can be treated once and for all. And there are conditions which we control, such as irritable bowel syndrome, and things like celiac disease, Crohn's disease. Those are diseases which we use other medication to control to improve your quality of life. So please don't have pain because of food and you just stay home. You can always visit us. We are located in Membley. My clinic is known as Hamat Healthcare. It's around 2 kilometers from the Thika Road roundabout. My telephone number is 0728-928-300. That is 0728-928-300. We are always available for consultation and helping you chart a way forward as you enjoy this festive season. And I wish you a Merry Christmas in advance.
Thank you so much. That is Dr. George here, a general surgeon, going in with a lot of expertise. And for those of you who are following us as we go out, it's important that you watch what you eat because it communicates how far you will go in life. It's very, very important. It's important to pay attention to your body. When it's talking to you, it's communicating, you pay attention. And that is it for now from the Healthy You talk show on Faith Through Day Television. And as we conclude, we always pray for those of you who are following us We've had people following us from Roysambu. I don't know wherever you are watching from, you are in hospital, you are under any form of treatment. We pray that your healing may come forth speedily in Jesus' mighty name. If you can type amen, I will appreciate that, and I know that you will be fine. Now, for those of you who are students and you are a healthcare provider, you want to take the next step towards a rewarding health career. Again, JCK Hospital College of Health Sciences is now open for admissions. Use the number on your screen. They are having a few slots available. Make sure you book yours, get such expertise, such learning, so you can be competent with whatever you are doing out there. And of course, this is Enock Kitondekijja, and this is the Healthy You. Until we meet next time, stay healthy, stay proactive, and stay informed. Have a good week.